Melanoma accounts for only about 1% of skin cancers, but causes the majority of skin cancer deaths. New data show melanoma death rates significantly declined from 2013 to 2022. Here to tell us how advances in treatment are making a big difference is Dr. Mark Gimbel, surgical oncologist at Banner MD Anderson Cancer Center. I know you have a lot more titles to your name, but we're going to keep it at that for now.
That's perfect.
Hey, so let's talk about some of these treatments. Can we run through? I know surgery is one. How is that helping?
Sure. So with melanoma, obviously the goal is to identify it early, because if you can identify it early, it's 100% cure. And so the way to cure it is first to be screened. If you get the screening done and your dermatologist finds something, have it removed, and it gets taken off, great, you're done. The problem is when melanoma progresses beyond that early stage, when an excision or a surgical resection is not enough. And that's where we saw a lot of the deaths from melanoma as it progressed, because there were no good treatments for melanoma. People historically would die once they had melanoma that spread to the lymph nodes and spread beyond. Only recently, within the past 10 years, the treatments have progressed so much that we're now seeing people with widespread cancer who are being cured.
So you mentioned if your doctor notices something, make sure that it gets checked out. Who is most at risk, and what is it we should be looking for?
Sure. So living in Arizona, we're all at risk for being under the sun. The sun causes over 95% of all melanomas. Ultraviolet radiation does. That could be mostly from the sun, but also from tanning beds. So we need to limit the amount of ultraviolet radiation you're getting. So prevention is the first key. Sunscreen, clothing, staying out of the sun at the high points of the day. That's the most important thing.
And high points of the day are?
Between 10 and 2 typically. So if you're a swimmer, you don't want to be in the pool at that time. Try to go after 2, a little bit later in the day or earlier in the morning when the sun isn't as strong.
And when you say sunscreen, I often hear reapply every X hours, and how much? Can you help us out with that?
Yeah, so we recommend sunscreen to use at least an SPF of 30. Beyond that, you do get incremental benefit, but that benefit is small. We want a broad spectrum sunscreen using both protection for UVA, UVB radiation, and C as well. You want to be applying it every 2 hours. And it's not just spraying and going away. You have to get a good base amount into the skin so it gets absorbed, and that protects you. The problem is when people go outside, what do? They sweat. And when they sweat, they wipe their suns down and they wipe the sunscreen off. So that's why it needs to be reapplied. Recommend every 2 hours or so.
Should it be like the very first thing you put on your skin if you put moisturizer on or makeup? Like, should it be sunscreen first or last?
Well, we always like to have that first because that's how the skin is going to absorb it. There are actually a lot of makeups that do have sunscreen built into that as well. So that could be a combination as well where you could put it together so you don't have to have 1 or 2 different things on your skin.
Thank you for letting me veer off a little bit. Let's get back to the advanced treatments because it's very exciting. Immunotherapy, what does that mean and how is that working?
So as I told you earlier that when melanoma had already spread, it was lethal. But we found ways to actually utilize your immune system to go after cancer cells. Typically, the immune system doesn't recognize cancer as foreign. It's your own body growing out of control and your body doesn't see it as foreign, so the cancer can continue to grow. However, with this newer class of medication called immunotherapy, it takes the brakes off the immune system, so now your immune cells can recognize cancer and go after attack cancer cells. And not only does it attack the cancer cells, but it can make memory to the cancer, where if it's spread throughout your body and you respond to it, you can have cure from even if it is spread throughout.
Is that different than targeted therapies?
So the other ways to treat cancer in its more advanced forms is chemotherapy. And chemotherapy is essentially a poison, if you will, that you put throughout your entire body. You kill good cells and bad cells, but hopefully preferentially kill the bad cells. Targeted therapy means when you have a cancer, there are certain proteins on the wall of the cancer cell. And you can recognize those proteins, and you can there's drugs that can now recognize those proteins. And so that can identify the cancer cell alone, leaving your normal cells behind and only target the cancer cells. So that's what targeted therapy means. And immunotherapy means activating your immune system to go after cancer cells.
All of this sounds like incredibly positive news, and I don't know if it's me being Debbie Downer or what, but sometimes I think when we talk about, such great advancements have been made, that maybe people get a little comfortable and think that it's not necessarily as dangerous as it is. Do you see that, or are you very optimistic and just glad that these advanced treatments are working?
Yeah, melanoma is a scary diagnosis. I haven't seen where people are comfortable with that diagnosis at any point, even at the early stage or the later stage, because of how lethal it can be. Not everybody is going to respond to treatment. A good proportion will, but it is not something that you should take lightly. You want to get that identified early. If you have spots that are changing or dark, get it identified, because the earlier you can identify it, the better your outcomes are going to be. So nobody should feel comfortable with a diagnosis of melanoma.
And wear that sunscreen. Every 2 hours reapply.
Absolutely.
Dr. Mark Gimbel, thank you so much. Really appreciate you coming in.
Thank you for having me.